I always tell patients when they come in to see me, what is it you want? Sometimes patients will say they really just want to have somebody help them lose weight without surgery. Sometimes patients will say, I want surgery. Generally, if your body mass index is over 40, your chances of long-term success with anything other than surgery are small, really on the order of about 3%. The patients who have a body mass index between 30 and 40, certain subsets of those patients should also be considered for surgery because they've developed diseases that are related to their weight that can be dangerous. But outside of those sets of patients, patients with a body mass index of 30 to 40 should be considered for medically managed weight loss. There is a lot of personal effort with medically managed weight loss. There's a lot of support that goes into it, but effectively, it's a diet, and it's a diet that's being managed with help. And so, if patients have been successful with diets in the past, that may be all they need. On the other hand, if they've had real trouble with diets, then we would tell that patient that they need to be considering something like the Orbera balloon. The balloon is a non-surgical option. It's endoscopic, which means we put it in the GI lab. We put it in with a scope down your throat. We don't make any incisions. And the balloon is placed at the start of your weight loss period. Literally, I just run a endoscope down the throat, and in the stomach, I inflate a balloon that's about 11 ounces in size. The balloon stays in place for 6 months, and during the time that the balloon is in place, the patient will lose weight because, frankly, it's difficult to eat around something that's occupying 11 ounces of your stomach. And so patients will eat less. They use that time to learn the behaviors that are easier to learn when you're not as hungry. And then at 6 months, the balloon must come out. We remove the balloon, and then the patient stays in that same medically managed weight loss for another 6 months in an attempt to try to solidify the behaviors that they learned during the time the balloon was in place.
To learn more about all of the weight loss options Bon Secours offers, medical, surgical, and balloon, call 757-673-5990 and ask to register for the complimentary Weight Loss Options Seminar.